How's it going, everyone? My name is Dr. Dave Wong, and I'm a chiropractor here in downtown Pleasanton, and today I would like to demonstrate a chiropractic adjustment. Here I have a patient here who I have been seeing for at least a year, so I'm pretty familiar with his body. We already did the exam, and now we'll start proceeding with the adjustments. As you can see here, you have 7 vertebrae on the neck, 12 vertebrae within the thoracic spine, and 5 vertebrae of the lumbar spine or low back, and then you have your sacrum. The sacrum used to be 5 separate segments. As we grow older, these segments fuse and turns into the sacrum. And so now I'll do my analysis. First, I usually check the legs to see if there's any unevenness. And if you could even go towards here, you could see that the right foot is actually or the right leg is actually shorter than the left. And as I bring it up, it actually gets longer as I bring it up as well on the right. And then I'm going to find any tension here. Yeah, it's pretty tense on the left side right here. Remove the spine here. And so now I usually do some challenge tests here to see what should be adjusted. That evened out the legs just by swiping that. And I'll check the sacrum. That didn't really even out, so I'm just gonna adjust the right ilium here. Could you bend your knees for me? Yeah, the right side here is pretty stuck, and so let's move that. So now I'm gonna have you face me this way on your left side down. So this is a side posture adjustment. It's pretty common for chiropractors to adjust the low back like this. Have you come a little bit closer. So I'm looking for my contact point here, for the ilium here. Take a deep breath in and out. How'd that feel?
Great.
Yeah, let's have you face down. And now, we should see the legs even out. Even. And I'll bring it back up. And it goes even. Nice. And now I'll just proceed up the spine. So I'm sensing some temperature changes as I go up the spine here. It's pretty nice and mellow right here, but as I go up, there's a bit of heat right here. And now I'm just pushing on the spine here. Yeah, this way, right here. It's not really as bouncy as it should be. And so, okay, I'm gonna have you face up for me. Then I'm just gonna have you bend your knees for me. Give yourself a hug. And now I'm gonna adjust the thoracic spine. So let's see here. So take a deep breath in. And out. Awesome. Let's have you face back down. And now I'm just rechecking here. Yeah, that feels a lot better. Yes, it does. And so now I'm going to check the neck. So let's have you face up for me. So now I'm going to check the neck here. And so the neck actually feels, there's a little bit going on right here to the right side. Yeah, he feels it. And then, but even more so up here. Bend your knees for me. That way it just kind of loosens up the muscles. Don't want him to strain while we do this. Right there. So let's have you take a deep breath. And he also mentioned to me that he has some knee pain, right?
Yeah.
Yes. So I'm going to check the knee here. So let's bring the legs down. And yeah, as I'm palpating the joint line here, I could feel that the tibia has actually, there's a little rotational component going that way in relation to the femur. And so usually with the knee, it's kind of a delicate joint because you have your ACL and PCL and the collateral ligaments on the side. And so I usually use a drop piece here. Let's have you lift your leg up. Awesome. And with this, we're just going to do some light drops on the knee. So. Feeling that joint line, making sure everything's back in place. Awesome. Cool. Let's see how that knee feels. Yeah. Awesome. And he's able to do the squat?
Yeah.
Sweet.
Yeah. You feel it right away. It felt like there was tension or pressure on it,
Mhm.
even just by standing. Not anymore.
Not anymore?
Not anymore.
Perfect. Awesome. Well,